Good day po ma'am, I am Morris Balicera, student test po for today. Kukuhanan ko lang po kayo ng BP, so okay lang po. Okay po. Performing hand hygiene. So matanong ko lang po ma'am, no? Ano po yung kadalasan or normal na nakukuha niyo po ng BP?
Usually po 120 over.
120 over 80 naman po, so normal naman po yung rate mo. Assist the client into the comfortable position, either lying or in sitting position. Place the upper arm into the heart level with the palms facing upward. Move the clothes away from the upper aspect of the arm. For the procedure, wrap the plated cuff evenly around the upper arm. Apply the cuff snugly and smoothly over the upper arm. Wala po lang. Before you place the stethoscope, make sure to palpate the brachial artery in the antecubital space using the index and middle finger. Then insert earpieces of the stethoscope into the ears and forward tilt. Relocate the brachial pulse and place the diaphragm directly over the brachial pulse. For the procedure of taking the blood pressure, close the valve of the pump by turning the knob clockwise. Inflate the cuff to the 33 mm of mercury above the systolic reading of the client. Then release the valve to the cuff carefully so the pressure decreases at the rate of 2 to 3 mm of mercury per second. As the pressure falls, identify the manometer reading by listening to the Korotkov sounds. Mark the first audible sound as the systolic pressure reading and the last audible sound as the diastolic pressure reading. And deflate the cuff rapidly and completely. So ang BP niyo po ma'am ay 120 over 80. Normal po ulit ang inyong BP. Ito po ma'am. Performing hand hygiene. Documenting the final findings of the procedure. For temperature checking, we all just need the digital thermometer, container with cotton balls with alcohol, and container with soiled cotton balls. Performing hand hygiene. Kukunan ko lang po kayo ng temperature, ma'am. Place the thermometer well in the mid-axilla with the bulb directed towards the patient's head. Bring the client's arms down close to her body and place forearm over the chest. And leave the thermometer until it alarms. Normal naman po yung temperature nyo. Ang temperature nyo po ay 36.5. Clean the thermometer in rotating position from valve to stem. Dispose the used cotton balls. Performing hand hygiene. And don't forget to record the temperature in the chart. Perform hand hygiene. Ma'am, kukunan ko lang po kayo ng pulse rate. Place the client in a comfortable position, sitting or lying with the arms along the side of the body, with wrists extended in the palm of the hand, facing downward. Place the index and middle and ring fingers along the radial artery and press gently against the radius and the rest of the thumb on the back of the client's wrist. Use watch to count the number of the palpations felt for 1 full minute. Repeat the assessment if the findings are abnormal. Performing hand hygiene. And of course, document the findings. For respiration, leave the hand on the wrist after you finish counting the pulse rate. Observe the client's respiration and measure the rate by looking at the rise and fall of the abdomen or chest, and count the respiration rate for 1 full minute. Ma'am, kakount ko lang po yung respiration niya. Record the findings. Perform hand hygiene.